I'm happy to be joined by Aisha today. Thanks for taking some time to be with us here.
Thank you so much for having me. I'm so
Yeah,
excited to be here.
yeah, same here. Really, really thankful to have met you. We kind of ran into each other. We do have that tendency online to kind of run into each other, and it's all meant to be. So really thankful that you're here. And I know that you have a story, and that's one thing we um can connect and resonate with is that even though it's similar, it's still very different, because we're different people and all of that. Let's start at the top. And when were you diagnosed? Your age, if you have anything that stands out as far as your diagnosis story that you think would be interesting to share, we'd love to hear.
Right. Yeah, so I was diagnosed when I was 4 years old. That was 30 years ago, so I'm 34 now.
Okay.
um, yeah, the main thing I remember because I was so young was just extreme thirst. And
Yeah.
my parents were like kind of debating about what that meant. My mom was not aware of type 1 diabetes at the time, and she thought like maybe I was just acting out for attention, but she really didn't know. Like, kids do act out for attention sometimes, so like
Sure.
I can understand that. And then my dad, he was saying he thought that they should take me to the hospital because his coworker had type 1 diabetes, and so he recognized the sign. So
Those clues are amazing. I know that definitely helped your parents just trying to kind of steer them as to what it could be. So that's awesome. Yeah.
yeah.
And my gosh, you were 4 years old. It's no wonder you were at that age is, we're kind of all over the place at that
Yeah.
age as far as our temperament and our behavior and all of that. So, awesome. Yeah. Yeah. So what was that like as far as if you can remember being four? I don't know. Do you have any specific memories?
Well, I remember being in the hospital and
Do you?
like I remember the nurse came over and my parents were standing over me with the nurse, and the nurse was like, "Who do you want to give you, or do you want your mom to give your shot,
First shot.
or do you want your dad to give your shot?" The way that she phrased it, I forget, but like in my little kid brain, I thought she was asking me, "Do you want a shot?" And I was like, "No, I
No.
don't, I don't want a shot." It's interesting
Yeah.
how like um communicating with kids, you have to like word things.
That's true. That's true.
Yeah, and so I
That's true.
remember we just
Yeah.
kept going back and forth, and then eventually my dad was, like, explaining, "No, you're gonna get a shot, but which one of us is gonna give you the shot?" And so I chose my mom.
Nice. So how are you managing? So you went through obviously adolescence, adulthood,
Yeah.
puberty. Imagine that, because that's when I was diagnosed. I was 14. So, and that was just like, and actually, I was about 10 years after or before you. So I was early 80s. Sounds like you were early 90s, if my math is
Yeah.
correcting me right. Yeah, as far as that year. So technology was a little more advanced, not much, but a little more advanced by the time you were. So what were the tools that you were using at that time as far as insulin? Did you have access to an insulin pump?
Oh, yeah, so at that time, it was multiple daily injections.
Yeah.
We didn't Pumps were not widely available at that time. I was using I think it was something like NPH, I think was the cloudy one,
Yeah, I remember.
your acting one, and then
Yeah.
I think the faster one, I think it's called, either fast or medium, I forget what it's called, but I was using
Yeah.
R
Yeah.
for, like,
Yep.
my food and my
Yep.
correction.
Same here. Same here. MPH and regular. Yeah.
Yeah, and then you,
Yeah.
like, put them both in the syringe at the same time, or at least that's how.
I know. That's something we've never really talked about here. And it's funny how things get triggered because I was talking to somebody, I don't think they live with diabetes, but we were just kind of talking about all the different insulins that we had when we were growing up. And why were we doing that? So I guess the cloudy, which was the NPH, again, I could go back and look because it's not fresh on my mind as far as, the types and how it worked in our body. But it goes to show you how little we knew, especially myself, diagnosed. I didn't understand all of it. The doctor just handed it to you. You went home, you did what they said. You didn't ask anything. We were even dosing. I mean, myself, I was dosing pretty much the same thing for breakfast, lunch, and dinner,
Uh-huh.
right? It was not very well guided, was it? Yeah.
Yeah, when I was diagnosed, I think, like, early on, they taught us carb counting, so I started
Yeah.
using more of the sliding scale, but yeah, I think my mom would probably know a little bit more about, like, how difficult it was, like, the onboarding process of that.
Yeah. Yeah, can you imagine? Yeah, yeah. And then nowadays, these newer families or new families that are getting newly diagnosed children, the medical tools we have now, the technology, the CGMs, the share capabilities of the apps and all of that. It's amazing. Yeah. Yeah. So what is your relationship now that you're in your 30s? I know we'll just kind of fast forward, but feel free to kind of interject anything that you can remember or, anything that comes to mind as far as growing up with diabetes. So what's your relationship with the day-to-day now? Are you on an insulin pump? I can assume.
Yeah, I'm on the
Are you?
Omnipod.
We do use the same Omnipod. Yes, I've got mine on my arm. I just put my new one on last night.
I feel on my stomach, but I'm
On your
really
stomach?
confused, so otherwise
Yeah.
I would show you
Yeah.
otherwise.
Yeah. Yeah, so how is that working for you? That you got that dialed in pretty good?
Yeah, yeah, I like it a lot better than the Tandem. I was on the Tandem for a couple years, and I feel like I really did not like the Control IQ automatic boluses. And like with my menstrual cycle, like insulin fluctuating, it was like too much to keep going back in and changing the
The setting.
settings of the insulin
Yeah.
sensitivity, and so then it would
Yeah.
be, like,
Yeah.
giving me boluses. I'm like, "Oh, I was planning to just go on a walk, and now I can't walk because I just got all this
Yeah.
insulin." So it was I didn't like it, and now with this Omnipod, I'm doing a lot better, and I'm not afraid to exercise as much as I was on the Tandem.
Sure, sure. So you're doing the auto mode on the Omnipod 5. And this is something I've talked a lot about here, especially recently on the show, because I just got on the Omnipod 5 just about a year ago, as we're recording this. October of 2024 is when I started it, and I was MDI for 42 years. Quite a switch over. But I transitioned pretty good. I mean, I think it does help to start with a system because I don't think we can just jump around to different pumps or therapy settings or anything like that, thinking that the next one's going to solve your issues. I really think you've got to kind of zone in. It's really not the technology, it's really us that we have to kind of come to terms with
Exactly.
or, just kind of find that acceptance and because there's a lot of give and take. There's things that we've got to be flexible with, things that we've got to maybe take a step back and kind of learn more about not only the system but ourselves and how it kind of interacts. So what kind of lessons have you maybe learned from the Omnipod 5 versus the Tandem?
Well, I think being on the Omnipod 5, I appreciate that there's the automatic basal adjustments because that helps, like, offset maybe, like, if my sugars are starting to run higher, but I like being in control of the boluses, so and then I've actually I gained weight on the Tandem because I was having to, like,
Interesting.
keep eating to try to stay in range, and
Okay.
then
Yeah,
Omnipod,
yeah.
I lost 20 pounds. It
Interesting.
wasn't just because of the Omnipod, I was, like, doing things, but, like,
Some other things.
yeah, but it, like, helped make it possible, I think so. Like, I'm sure Tandem works great for a lot of women out there, but I think if someone's struggling with their weight or their blood sugars, they can yeah, like what you said, understand their bodies because, like, I have to do a lot
Yeah,
of overriding on the Omnipod. I'm like, "Okay, it's wants to give me this much, but I know I'm more sensitive or less sensitive, so I'm gonna, like, override it." So
sure.
but it can't, like, solve all the problems, but switching to a different pump might help. So it
Yeah,
helped with
yeah. Yeah, yeah, I have to agree. I think, a lot of people I think that don't live with diabetes, they think, oh, you got the pump, it does it all for you. And well, it definitely is an aid. It's there as, obviously it's there. But I like the idea because I don't think I would want something that I don't have any say so with,
yeah,
because I think what happens is we can easily get detached
yeah,
from life with diabetes. And I think in essence, we kind of want to be detached.
yeah,
Right, but, no, I don't know. I think long term, I think I wanna be part of the decision making, so I think that's good, but there's such a delicate balance with that, isn't there?
yeah,
Yeah, yeah, so how do you deal with that every day as far as how often we're looking at our numbers, how often we're looking to see how much insulin we have on board? Again, great tools, great information, but we still have to find a way to kinda put it in its box
yeah.
in a
Well, like, during the week when I know I have a lot of important things, like work and stuff like that, I know I don't want to be looking at my phone as much with my blood sugars, and so I eat a lot less carbs during the week, so I don't have to worry about, like, did I take the right amount of insulin? Kinda thing, and so look at it, but I'm not, like, staring at my phone. But on the weekends, I let myself eat a little bit more carbs, and my blood sugars are a little more up and down, and so I'm, like, staring at my phone a little more, but I feel like I have freedom to do that on the weekends.
Yeah, I like that. I think that's the number one thing that we've all gained is the just having the data as feedback, because we can either get beat up by the feedback or judge, we can judge ourselves by it, or we could just use it as, again, another tool for sure. So do you happen to have any other autoimmune diseases?
Yeah, I have hypothyroidism, Hashimoto's hypothyroidism. I was diagnosed shortly after type 1 diabetes, so I've had both conditions for about 30 years now.
So that's interesting that you bring this up, and this is not something I've talked publicly about yet because actually the testing is still being done on myself because I've been running into a few things that may be thyroid related. So as we speak, I'm still waiting for one more test to come back to my endo just to see whether or not I end up on some thyroid meds. So isn't that interesting? Yeah, the timing of it. And so this is interesting because I think, and again, I've talked with some other people, whether it's friends, women in my age group or whatever, but we have this relationship with being on medicine, don't we? Or we have this kind of a it's almost like a ding in our armor, isn't it? Did you feel that way when it had to be? It's like, oh gosh, another thing isn't working in my body. Did you have any resistance for having to take that step with the thyroid meds?
I actually don't remember. Like, I don't remember being diagnosed. I think it was a lot less dramatic than the type 1 diabetes.
Okay, okay.
I was already taking shots every day and all this. So it's like, okay, just take a pill now. So,
Okay, so it just kind of added on to it, yeah. And and I think this is a great opportunity. Again, this is something I'm dealing with as we speak, and I'm also on hormone replacement. That's another thing that we advocate a lot here on the show. We talk a lot about it, and I think in thyroid, insulin, estrogen, progesterone, all those things that our body naturally makes and produces to help us live better,
uh-huh.
and they're all in balance, so they speak and kind of bump up against each other. So I have no issues. If my body is showing that it needs something, that it is depleted in something, and all cylinders are not firing,
Uh-huh.
I have no issues with that. I'm very thankful that do have that response and that
Yeah.
relationship with, well, if I end up on, something that's going to help with my thyroid, again, that's going to help my life with diabetes. It's going
Yeah.
to help my hormones. Personally, I think that's to get there really is very helpful to kind of have that kind of that mindset around it.
But yeah, definitely. I think sometimes diagnoses are a positive thing because then you know how to fix it.
There you go. Yeah, yeah. Oh, that's magical. The worst is when we're chasing the symptoms and we're trying to figure it out, and we're taking this out, which is not a bad idea. We can pull things out of our diet, think it's this and that, and that's a cool experiment. I definitely do that. I've done that with myself. I've done that with clients I've worked with. But it really is nice when you can just kind of get the whole story, get the labs done, unpack the whole story, the full picture, and then you can kind of attack it or kind of go into it with obviously something that's going to make sense.
Yeah,
And yeah,
definitely.
yeah. So what about, speaking of hormones, we'll just kind of keep talking hormones here. How did puberty and your monthly cycles affect your management? So what did you start to see?
Right. So it's interesting that I lived with type 1 diabetes and hypothyroidism for like a while before going through puberty because I was involved in my care as a kid. Like, my mom really taught me to be independent. So like I could like tell the difference. And so when I was around like 15, I still had not gotten my period and I
Interesting.
I was feeling really tired. I already knew that was a sign of my hypothyroidism getting something's wrong with that. And so kind of long story short, my endocrinologist at the time wasn't really helping me too much, and my TSH kept rising, and so
Mm,
it went up to 36, which I think
wow.
the reference range is I don't know what the units are, but I think it's like 0.5 to 4.5.
Yep.
I was experiencing like all the symptoms really it put me in a dark place. Like hypothyroidism, I think the idea of it is like it's not that big of a deal. But when you're experiencing the symptoms, it impacting your life. And so we we changed my endocrinologist, and then I got that, and that also can hypothyroidism. If you haven't had your period yet, it can delay the period. Also, type 2
Yeah.
diabetes can also do that. So,
Yes.
and then also like I was a runner and all this other stuff. So, but yeah, so we changed my endocrinologist. I got my thyroid leveled out, and so I was like feeling more energized, but I still had not got my period. I went to a gynecologist and they said because of my they thought it was because of my thyroid problem that my FSH was low. So then they put me on progesterone to try to stimulate it, but then it gave me such severe migraines that I just couldn't finish the d- the medication. So then it
Yeah.
birth control, and then they put me on birth control for 1 month, and then the next month took me off to see if I could get it, and I couldn't. So they put me back on for a couple more months, and then by the time I was 17, I finally could get a period on my own, so it was, like, quite a struggle, and so, no one told me how the hormones would affect my blood sugar, and, so I just kind of started noticing, like, a pattern of high blood sugar for the menstrual cycle, and I didn't know that it was, like, normal or not. I just was like, "Well, this is my pattern, so I'm gonna, like, adjust my insulin."
Sure.
And then when I got to college, like, a year later, I was, like, asking my endocrinologist, I'm like, "Is this normal? Like, I'm noticing high blood sugars, I have to increase my insulin." She's like, "Yeah, it's normal." And I think the conversation around that kind of was just that was it. And then later, I told her again, like, "I'm struggling with the high blood sugars before my period, and I usually eat about my limit is 60 carbs per meal." And she said, "Well, then maybe we can try 40." But I didn't feel like that really made that much of a difference. So I just kind of,
Yeah.
like, kept adjusting my insulin as best as I could, and I even
Yeah.
would schedule my endocrinologist appointment for the end of the follicular phase because I knew, like, my she looked at only, like, 2 weeks of data, so I was like, "I don't wanna review the other weeks."
That's interesting. Yes. Yes. Wow. Well, you know, something that you just said that pointed out that really struck me is that you asked her if this was normal. This is your endo.
Yeah,
And she said, yes.
yeah,
Wow. That's surprising because most endos don't see the correlation. To this day, I have never had an endo that even really wants to talk about the other hormones. So it's interesting. They're not educated, or you just got lucky, or you continue to get lucky with somebody that is aware and that validates and reassures you that, yeah, you're not going crazy. Yeah, yeah, there is a reason why, especially during your luteal phase when estrogen starts to drop and it gets a little chaotic. And I have an upcoming book coming up. I'm not sure if you're familiar with that, Aisha. It's going to be the highs and lows and hormones, and it's going to be a survival guide from the monthly cycle to menopause. So, just what we're talking about is definitely going to be part of that because it's really going to be a help for all stages, all women, all the things like I'm saying. I didn't know any of this, so I stumbled. I stumbled through puberty, pregnancy, postpartum, premenopause. I didn't know any of this. So I think it's really important that we can get the facts in a guide that everybody can, all women can refer to when and if they need it. Yeah, for sure.
that's great. I'm excited. I wanna read it.
Yeah, thank you. I appreciate that. Yeah. Yeah, I'm knee deep into it right now. Yeah, we are hoping to launch it and have it published early 2026. So, yeah, stay tuned for that. And, conversations like this really do matter, and it just reinstates how important this is, hearing your story and what you've learned about your body, which is everything.
Yeah.
And how we can use those lessons to kind of steer it because we want it to, kind of help influence our outcome, not taking that negative step back with it. So that's really, really good. Yeah. So if speaking of all of this, so what is your, because you're still young, you're in your mid-30s. So how do you feel about the aging process and your future with type 1 diabetes and hypothyroidism? Yeah. So what are you seeing, or have you even thought really about that yet?
Yeah, and I'm so glad that I came across your content and I'm listening to your podcast, and I feel like more hopeful that like I can be guided by people like you. But yeah, so I do notice a difference from when I was like even in my early 20s. Now I'm 34. I'm noticing the difference in my insulin sensitivity between, I'll just say follicular and luteal, just to like, because there's a lot going on within those, but from
Mhm.
follicular to luteal, I'm noticing a much bigger change in my sensitivity than it used to be. Like, there's always been a change in sensitivity, but like an example is like before my lowest carb to insulin ratio it would be was 6 carbs per unit and like right before my period. Now it's 3 carbs
Okay.
per unit. And with
Yeah,
the
yeah.
follicular, I think it's about my sensitivity is about the same. Like, and also I read that the drop in the progesterone and estrogen doesn't necessarily happen right when you get your period. So it could happen like a
Mhm.
few days or a few days after. So it's like I don't know exactly what day it's gonna be where like then there's a drop in the hormones and then my sensitivity
Sure,
increases and it's like going from like
sure.
3 carbs per unit for a meal to like 15 carbs per unit is like very
Yeah,
scary. So that's why I like to avoid carbs. Like before when I was in my early 20s, like I wasn't afraid of the carbs. Um
okay.
like I had some sort of limit because I felt like there needed to be a limit. But yeah, like I'm a lot more careful with my carb intake now.
Okay. That's interesting. So that's the strategy that you're using right now, which is very proactive. You're just saying, okay, let's just eliminate that food source, which is carbohydrates. We all know that that's what's going to increase the blood sugar the most, the quickest. So you're just eliminating it. So give me an idea of what you're eating, say, for breakfast on days like that, or lunch or dinner. Yeah, just give us an example. I'm trying to picture what your meals would look like. And this is not judgment. This is pure curiosity. Yeah.
Well, on the weekends, I like to meal prep. So I meal prep deviled eggs, and I um, don't have that much time to eat breakfast and don't feel that hungry anyways, but I know I need like some protein. So I just grab a couple deviled eggs and drink some coffee with half and half in it. And I still take insulin even though I'm not eating carbs because I have the high blood sugars in the morning. So I'll
Yeah,
take,
we all do. That cortisol, right?
yeah.
Yeah,
And then
I'm sorry.
that's okay. The amount of insulin that I take in that morning also varies across the menstrual cycle. So, like right before my period, I might take 5 units of Humalog, even with 0 carbs. And then in like follicular, I might only take like 1 unit. So then I'm like also adjusting that. But
Yeah,
yeah, just like the less insulin I could take, the less error in my dosages.
yeah,
And then
yeah,
for
understood.
lunch, I'll what do I usually eat for lunch? Like lately I've been eating cottage cheese with sunflower seeds on it. I also sometimes eat like for lunch I'm not as worried about my carbs because I feel like I'm not as resistant in the morning and I'm also not about to go to sleep. So if I do have a high blood sugar or low blood sugar, it doesn't scare me as much. Also,
Sure.
I might eat some more carbs at lunch, like maybe a sandwich with one piece of bread or and an apple on the side or something.
Mhm, mhm.
And yeah, and then for dinner, I usually try to eat as like almost 0 carbs if I can. So like I'll meal prep chicken legs over the weekend, like
Okay.
lemon and garlic chicken legs, and then I'll have a salad or some sort of veggie.
Gotcha, gotcha. I totally get it. Yeah, and that's where you've just come at it with, okay, this is what I know is more predictable because that's really what it is. During those phases when it seems like you can't necessarily, again, predict or really have a dosing plan around. And the pump, it does help having the pump. I will say I've noticed that wearing the pump now. Obviously, taking shots is taking shots, it's having to inject manually. And I'll tell you what, it is a whole lot easier when all I gotta do is pull up my phone because I got the O5 app on the phone. Boy, what a saver that is. I only got the one device and I always kid that I'm literally just carrying my insulin. It's so weird. I'm so used to having it, it's like, God, this is a whole new, definition of freedom,
Yeah,
which I really appreciate. And knowing that, if you start to kind of bump up, say after lunch, say like for an instance, I have days where, if I'm recording, I'm online with clients or running sessions that I'm sitting more, even though, you may have a walk in the morning, but there's still the impact of exercise or lack of exercise really does affect what's going to happen. So I like that flexibility with the Omnipod 5, and I'm sure a lot of the other pumps have the same sort of addition is being able to just kind of hit that correction factor.
yeah,
My blood sugar's hovering about 160 and I got nothing on board. And I'm like, I obviously just need a little bump, and
Yeah.
it's really, really cool that we can do that.
Yeah.
And, within 30 minutes, what kind of insulin are you using with the Omnipod 5?
Humalog.
Okay, Humalog. Well, I switched over to Fiasp. Again, my pump trainer gave me that idea, and I guess a lot of endos are starting to use that because it is all about that timing, trying to get it in a little quicker, and that has really helped too. So, especially when we have those meals that just kind of get us up a lot quicker than what we expected to.
Oh,
But especially, and I think maybe around the cycle time too, that might be another addition. Definitely something to check out and look into.
but yeah, I'll definitely ask
But
you about that.
yeah, yeah, most definitely. But yeah, thanks for sharing your example. And,
Thanks.
you know, would you say that do you follow a cycle tracker? Do you have a pretty good idea
But
of
yeah,
when your cycle is going to happen?
I have my cycle tracker, but I feel like I I don't start adjusting my insulin just based on the tracker because it's not super
Okay.
accurate. It might be
Right.
off by a couple days. So my insulin sensitivity could be like way different. So I just wait until I see like I'll be watching my cycle tracker. I'll be like, okay, I should be in the follicular phase or I should be in the luteal phase. But then I wait to see the blood sugar trends changing and then I start adjusting. So I always have to wait until
Okay.
my menstrual cycle is already having an impact on my blood sugars before I could
Yeah.
fix it, and I can't,
Yeah.
like, prevent it because I tried to do that before. I tried to, like, "Okay, last month it was on this day," so then I started, like, increasing my insulin, and then I went low, and it was like, "It's not good."
Wait for your body to talk and
Yeah,
and to respond. Again, we this disease is a pain in the neck. We all realize that, but we do have that ability with these settings to really just adjust and just kind of say, today's the day.
yeah,
Today's the day, and I'm starting to feel a little resistant.
yeah.
And sometimes too, do you notice I mean, our body feels different. You feel a little bit more inflamed, maybe a little more puffy.
Oh, yeah.
So again, all those symptoms that we just need to remember
Mhm.
and track and be in tune with that can really kind of lead us to making those decisions around the pump settings or the injections and stuff like that. So really good. I appreciate you sharing that.
Me too.
Yeah. Yeah. What about now you're in the diabetes industry. You work in the field and you're familiar with research and all of that. So is there anything you'd like to see in future diabetes research, technology advancements, anything kind of trigger or maybe something that you see as a possibility that you're hoping is going to happen sooner than later?
Oh, yes. Yeah, like I'm kind of in the diabetes space as like a on the side, but yeah, I'm a medical copywriter. Yeah, so the diabetes thing is like I have a website and the YouTube videos.
Hmm.
Future, I am deep into the research though. I wrote like a research paper. I've what I would like to see is I think there is so much inconsistency with the methodology on the research on how the menstrual cycle affects glucose control and insulin resistance in females with type 1
Hmm.
diabetes. The methodology, for example, it's inconsistent across different papers about like how to even define the different phases and how to confirm those different phases and even how to measure the effects of on glucose and on insulin sensitivity and all that and how to analyze it. So there's a lot of inconsistencies in the methodology. And I think if there was more consistency that then the research could be repeatable and there could be more
Yeah.
we could understand better the menstrual cycle.
Yeah. Yeah.
I was like, I have not seen any widely published international consensus workshop with a panel of experts that like sat down and decided how best to study this.
I was just going to ask you that. Yes. Yes.
Yeah, so I feel like I have my own opinions about what I think the research, how the methodology should be, but I mean, the experts really they need to sit down together and discuss this and publish it. So that's what I really
Yes.
think.
Yes. So I would love to hear what your ideas are. And do you know, because I am not as deep into this as you are. I'm kind of on the outside, just kind of watching and seeing what happens. But you're inspiring me to get a little closer to really what's happening. And so these experts do these, and this is just a question. And if you know the answer, would be great. But do these experts live with type 1 diabetes?
They probably some of them do. I didn't like look into their background.
Right. But But isn't that the best?
Yeah, I think that it's
Yeah.
the best because that really, like,
Yeah.
informs, um, how I see where there's holes in the methods,
Mhm.
and it wasn't just, like, me, like, I was like, it's, like, through reading other and I also wanna, like, kinda backtrack and say, like, I
Sure, sure.
I really appreciate all the efforts that go into researching this,
Mhm.
and there's, like, a stereotype that women are too difficult to study and too difficult to treat, and so I really appreciate the researchers that have worked so hard on this, and so, um, yeah, I just kinda wanted to backtrack there, like, just to, like, clarify, but sorry, what were you asking again?
Yeah, no, that's okay. Yeah, it sounds like you've definitely thought a lot about this. And so what would a perfect research study entail?
Oh,
Yeah.
okay,
Yeah.
so well, just a couple ideas.
Yeah, what's
So, like, first of all, I think that just comparing luteal to follicular, because 'cause I've seen research that
Mhm.
does that. We should be comparing more, like, subphases or, like, for example, menstrual, proliferative, ovulatory, and secretory, because it kind of lines up if you look at the graphs, which those graphs are not necessarily how your personal hormone graphs would look like, but it's just a general idea, and so but that kind of lines up with the inflection points on the menstrual cycle graphs of, like, estrogen and progesterone and LH and FSH. And so,
Mhm.
I I feel like my blood sugars are also, like, responding based on those, like, inflection points, and so, there's a lot of, like, events happening in follicular phase and luteal phase, so I feel like that's one thing I think we should, like, maybe compare, like, more like what I said, those other
Yeah, absolutely. Absolutely. Yeah. And something I've been speaking with another lady in this space who is part of some research with T1D exchange. And I'm not going to give any information or speak for her right now, but just to kind of give you a high view of what she recently shared with me. One of the things they're not looking at, so they're looking at when they are studying, and maybe you're familiar with these same studies, that yeah, they're just looking at blood sugar trends,
Yeah,
of cycle. But are they looking at how much insulin
yeah,
change? Because that's really what we're talking about. Okay, we know we've got a roller coaster, but why are we on a roller coaster? How much more insulin is required during the luteal phase? Because that is the data that reinforces the fact that things are different. And then you talk about the symptoms and you talk about how you're feeling because it's so much more to it, and all the different factors that we know impact
yeah.
how well our body utilizes glucose during those phases. So I get what you're saying. Yeah, there's a lot of layers to it, isn't there, to do a really good research study.
Oh, yeah, yeah, that was actually, like, the second point I was gonna make is, like,
Okay, I'm sorry. I took the words out of your mouth.
it's good. I'm glad that we're on the same page and we're talking about this. And yeah, like uh yeah, some of the research is only looking at glucose trends, some looks also at insulin, but even the ones that look at insulin, those two are inverses of each other. So like if I take too much insulin, my blood sugar goes low, but that doesn't mean the menstrual cycle caused it, or vice versa. I take too
Right.
little, my blood sugar goes high, that doesn't mean the
Yeah,
menstrual cycle caused it, or I take the
that's right.
perfect amount because I'm adjusting it and maybe the data doesn't show that there's any impact, but there could be because I was adjusting
Yeah.
it.
Yeah. Yeah.
By Goldner, and they took the product of the insulin times the total daily insulin times average daily glucose level,
Okay.
and it kind of accounted for that.
Okay. Okay. Yeah. Okay. Slowly but slowly but surely they're going to get there.
Yeah,
Yeah. And just like you say, I'm just happy it's being
yeah.
discussed. I'm
Oh, yeah.
just happy that it's like, well, maybe this is something that we need to look into.
Yeah.
And then the other side of me, because I'm always playing devil's advocate with stuff, research is great. Research is going to prove, maybe it's going to help educate, maybe it's going to get into the medical schools with education and all of that,
Yeah.
and it's going to help to inform the doctors. But we really are the living experiment. And this is, these are things I'm going to have in the book as well. We're going to be citing some of these studies, but I don't need a study to tell me whether or not I'm insulin resistant during my luteal phase.
Yeah.
It proves it, it points to it, and I think it does help create the awareness.
Yeah.
But I think the best thing we can do as women is to be loud about it and to express it and to advocate for it with our doctors. Yeah.
I agree.
Yeah, don't you agree? Yeah,
Oh, yeah, I'm
yeah.
not waiting around until the research tells me that I need to increase my insulin.
Right. Exactly, exactly. We know. And again, that's when it comes right back to they should be, and I'm sure these studies are they're obviously doing the studies on women with type 1 diabetes throughout different age groups and all of that. Yeah. So yeah, the less or the more to come on all of that, I'm sure. I'm sure that it's exciting to, again, just to be considered. And women's health in general is not studied.
Yeah.
That's another whole topic. So menopause is just now starting to kind of shine and, be talked about, which is a good thing. So most definitely. Well, do you have any lasting, maybe inspiration that we can learn from? We've learned a lot about not only you as a woman who has grown up with a chronic disease, not one, but two diseases, because hypothyroid was something that just kind of paired with that. And is there anything else that you'd like our listeners to kind of learn a little bit more about you?
Oh, yeah, so I have a website called
Mm-hmm.
heatherhealth.com and
Uh-huh.
a YouTube channel, Her Homeostasis, and there I talk about the female experience of living with multiple chronic illnesses.
Yeah, yeah. Thank goodness for women like you that take the time to share your stories and share your advice and to give encouragement. It's real important. Yeah. Keep doing what you're doing. We're really proud of you. And yeah, thanks for being here.
Thank you so much
Yeah.
for having me.
Yeah. Yeah. Well, Aisha, we are going to link all of what you just shared right here in the show notes so people can reach out and stay connected with you and meet you.
Thank you.
You're active on social media as well. Can connect with you there. And again, please connect with Aisha and reach out if you have any questions. And if you yourself have any ideas or input on research study ideas, if maybe this is in your wheelhouse specifically, ladies, and that are listening, yeah, let us know. Reach out to me on Instagram. I'm at Type 1 in Midlife, and you can find me on my website. And of course, keep following the show. Right, we got more great episodes coming up.
Thank you so
Again,
much.
thanks. Yeah, it's been a pleasure. Okay, everybody have an amazing day. We'll see you back in here next week. Bye for now.